Did you know there is a humble plant that can soothe your horse's stomach, skin, and stress all at once? Discover the powerful natural benefits of aloe vera for horses. Aloe vera is a cactus-like plant that is a member of the lily family. There are more than 200 species of aloes. All aloes have strong, fibrous roots and numerous persistent fleshy leaves, which proceed from the upper part of the root and become narrow, tapering, thick, and fleshy, usually rimmed at the edges with spiny teeth. The flowers are produced in erect, terminal spikes. All aloes share a similar appearance and can grow very large. In some areas of southwestern Africa, aloes are seen in excess of 25 feet tall, with stems that are more than 10 feet in diameter. Aloe vera originated in Asia Minor and is one of the few plants known the world over by its scientific name. Aloe vera means true aloe, to distinguish it from 200 species of aloe. Aloe is from the Arabic aloe, or the Hebrew halal, meaning a shining, bitter substance. Aloe vera is sometimes referred to as Aloe barbadensis, a native of northern Africa, but introduced into the Barbados Islands in the 17th century. It is said that a certain variety of Aloe barbadensis is the actual aloe vera. Those who apply the caveman theory consider that ancient man noticed that aloes, along with other plants of the class of xeroids, could close their stomata completely to avoid loss of water. When a xeroid is wounded, it closes the wound almost immediately, so that the plant will retain its water in the unusually hot climates in which it grows. Ancient man, goes the theory, thought that the plant must work the same for healing humans as it healed itself, and began to use it. Whether this theory holds water or not, the clear gel inside the plant's leaves has been regarded as powerful medicine for centuries. According to legend, Nefertiti and Cleopatra used it to enhance their beauty. Alexander the Great conquered Socotra because he wanted the island's aloes to heal his troops' wounds. Marco Polo reported that the Chinese used aloes to treat stomach ailments, rashes, and other disorders. The Egyptians used the plant medicinally as well as in their embalming practices. In 1500 BC, the papyrus Ebers listed many healing properties of the aloes, which were known long before this document. Dioscorides listed this plant as an important medicine. He said it could be used for wounds, stomach pain and digestive disorders, constipation, headache, itching, baldness, mouth and gum disease, kidney ailments, blistering, sunburn, and blemishes. The plant continues to be used for many of these same maladies today. Aloe vera, along with the other aloes, is so ancient that legend places it in the Garden of Eden. Although the aloes of the Old Testament were probably other plants, those brought by Nicodemus to embalm the body of Jesus were doubtless the true aloes. During the time of Jesus, the plant had been imported to Palestine, but was very expensive to purchase. Nicodemus brought 100 pounds of it with myrrh, indicating that he was very rich. Columbus's ship log refers to medicinal uses of the plant for sailors. Indian tribes living where the plant grew relied upon it for healing, especially for burns and other ailments. They called it wands of heaven. Spanish missionaries brought aloes with them to America and carried them from place to place to help the sick. Interesting ritual and religious associations have developed around aloes. The Mohammedans, especially those in Egypt, are said to regard the aloe as a religious symbol, and anyone who has made a pilgrimage to the shrine of the prophet is entitled to hang the aloe over his doorway. The Mohammedans also believe that this holy symbol protects a household from a malign influence. In Cairo, the Jews have adopted the practice of hanging up the aloe. Near Mecca, at the extremity of every grave, on a spot facing the epitaph, Burckhardt found planted a shrubby species of aloe whose Arabic name, saber, means patience. Its name refers to the waiting time between burial and the resurrection morning. It is mentioned in the ancient English Herbals as one of the drugs recommended to Alfred the Great by the Patriarch of Jerusalem, and is therefore thought to have been known in Britain as early as the 10th century, being brought into Europe by way of the Red Sea and Alexandria. As the herb, along with the centers of civilization, moved away from the areas where it thrived, it fell somewhat into disuse until the 1930s, where the first X-rays, being very crude, caused serious burns that responded to no other treatments except aloes. The gel from the leaf contains a miraculous number of substances, including polysaccharides, which are said to be the basis for healing in burns. The most important constituents of aloes are the two aloins, barbaloin and isobarbaloin, which constitute the so-called crystalline aloin present in the plant at 10 to 30%. Other constituents are amorphous aloin, resin, and aloemodin. The proportion in which the aloins are present in the respective aloes is not accurately known. The manner in which the preparation of the herb is conducted has a marked effect on the appearance of the aloes, slow and moderate concentration, tending to induce crystallization of the aloin, thus causing the gel to appear opaque. Such aloes are termed livery or hepatic, and splinters of it exhibit minute crystals of aloin when examined under the microscope. If, on the other hand, the evaporation process during preparation is carried as far as possible, the aloin does not crystallize and small fragments of the drug appear transparent. It is then termed glass or vitreous or lucid aloes and exhibits no crystals of aloin under the microscope. Aloe vera is a perennial succulent xerophyte, which develops water storage tissue in the leaves to survive in dry areas of low or erratic rainfall. The innermost part of the leaf is a clear, soft, moist, and slippery tissue that consists of large, thin-walled parenchyma cells in which water is held in the form of a viscous mucilage. So you see, the thick, fleshy leaves of aloe plants contain not only cell wall carbohydrates such as cellulose and hemicellulose, but also storage carbohydrates like acetylated mannans. Acemonan, a chemical compound found in aloe vera juice, is a powerful immunostimulant. Enhanced healing rates are indeed one of the major benefits reported with the use of aloe vera. The acetylated mannan component of aloe vera has been shown to increase fibroblast activity and collagen synthesis, which increased epithelial cellular division, producing enhanced healing rates. Fresh aloe juice, or commercially produced gel, contains dozens of minerals, proteins, enzymes, polysaccharides, and other elements that help soften and soothe the skin and promote the rapid healing of minor burns and wounds. Many of the health benefits associated with aloe vera have been attributed to the polysaccharides contained in the gel of the leaves. Aloe vera has been used for, many centuries for its numerous curative and therapeutic properties. Although over 75 active ingredients from the inner gel have been identified, therapeutic effects have not been correlated well with each individual component. In my opinion, this is because the ingredients of the plant work synergistically with one another to produce the healing effects. Trying to isolate each ingredient to a specific effect disregards synergy and is one of the reasons mainstream sciences fail to understand how herbs truly work. The raw pulp of aloe vera contains approximately 98.5% water, while the mucilage or gel consists of about 99.5% water. The remaining 0.5 to 1% solid material consists of a range of compounds, including water-soluble and fat-soluble vitamins, minerals, enzymes, polysaccharides, phenolic compounds, and organic acids. It has been hypothesized that this heterogeneous composition of the aloe vera pulp may contribute to the diverse pharmacological and therapeutic activities which have been observed for aloe gel products. In herbal preparations, primarily the gel-like juice of the inner leaf or the yellowish latex contained immediately beneath the skin of the leaves is used. Freshly pressed juice or stabilized aloe gel preparations are the most commonly used forms of aloe. Aloe vera is much prescribed externally nowadays, although its internal uses are many as well. Its most common use for people is as a burn medicine. Although ointments are now widely available for burns which feature aloe vera, probably the most common use of the plant is to cut off a leaf, trim it of its prickles, split it in two, and lay the wet interior on the burn itself. The pain subsides within minutes, and often blistering and scarring are totally eliminated. Other external uses for the herb include treatment for all kinds of wounds, scrapes, cuts, etc. The gel seems to mildly kill the germs on the surface and promote healing. The herb is high in calcium, which reduces bleeding with its coagulating action, at the same time helping to stimulate circulation of blood in the surrounding areas to bring oxygen to the surface. Aloe vera penetrates the skin quickly and deeply. This allows water and other moisturizers to sink deeply into the skin, restoring lost fluids and replacing the fatty layer. It permits the uronic acids, which strip toxic materials of their harmful effects, to penetrate deeply and allows the cleansing astringent qualities of the gel to work better. By increasing the circulation of the blood to an area, aloe vera sloughs off dead cells and fosters the growth of new ones. This helps foster the regeneration of scarred or blemished skin tissue and provides a protective coating on the skin to prevent the growth of harmful bacteria. This antiseptic action also stops skin infections in oil-clogged pores. It heals blemishes with little or no scarring. This accounts for the multitude of cosmetic preparations these days containing aloe vera. Aloe vera can stop itching, and as an anti-inflammatory agent, it has an action like that of steroids. One study reported that aloe vera inhibited the growth of several kinds of bacteria, including Staphylococcus and Salmonella, although more research has yet to be done on the plant's bacteriological properties. It has been used to reduce the itch of insect bites, the itching and burning of poison ivy, and to help remove warts. The juice of the fresh leaf is applied daily over a period of weeks until the wart is removed or reduced. Inflammation is a reaction by the body due to injury and is characterized by swelling, pain, redness, heat, and loss of function. This natural response can delay healing, but it may also be detrimental to suppress inflammation before its purpose is accomplished. Aloe gel reduces inflammation that is induced by agents via promotion of prostaglandin synthesis, as well as increased infiltration of leukocytes, but it is less effective against inflammation caused by agents that produce allergic reactions. Some people use the gel on their hair, and many commercial shampoo and conditioner formulas contain the gel. Indians in Mexico have used the aloe vera juice straight from the plant. They wet the hair at night, apply the juice, and after letting it dry all night, rinse it out in the morning. This is supposed to add luster, richness, and manageability to the hair. Aloe vera has almost the same pH factor as skin and hair, which can account for its cosmetic effect. Internally, a small dose of aloe juice may be useful for healing minor injuries and irritations of the digestive tract, such as those that may occur when a dog swallows a jagged bone. Scientists have found that escimenon acts as a strong immunostimulant in animals, particularly in cats. It has been found to be especially effective in the treatment of fibrosarcoma and feline leukemia virus. It is theorized that escimenon triggers an increase in the autoimmune attack upon the viruses believed to cause these usually fatal diseases. Typically, over 70% of cats who become ill with feline leukemia virus die within 10 weeks of the onset of the disease. But in one study, 44 cats with confirmed feline leukemia virus were intravenously injected with 2 milligrams per kilogram of asiminan weekly for 6 weeks and re-examined 6 weeks after the treatment was terminated. At the end of the 12-week study, 71% of the cats were alive and in good health. Asiminan has also been shown to be effective against cancerous tumors in rodents and dogs. Asiminan has been FDA approved for veterinary use. Aloe vera has had one main internal use as a very powerful laxative, more active than senna or cascara sagrada. It is rarely used alone because it causes griping and is not recommended for people with hemorrhoids as its prompt and urgent action irritates piles. It can activate digestion and even expel pinworms from the system. But because it is so active, it should not be used by a pregnant woman or during the menstrual period. A nursing mother will transmit the purgative action through her milk to the infant, and so should avoid its use as well. Aloe vera has recently been tested to confirm the empirical application for stomach and digestive ulcers. After reading the Soviet Union's studies of aloe vera and peptic ulcers, doctors in Florida tested it for themselves. 12 patients of varying ages who had ulcers were treated with aloe vera gel. In every case, after the juice or gel was ingested, the ulcers healed and no relapse occurred within a year of treatment. Aloe vera is also thought to perhaps prevent the development of peptic ulcers because it is able to inhibit the secretion of hydrochloric acid in the stomach, too much of which irritates the stomach's lining and leads to ulcers. A normal person's digestion would not be affected, however, other than leading to better assimilation and therefore better health. Aloe vera taken internally is said to help maintain good blood vessel tone and healthy circulation. The potassium in the plant is said to aid the heart's rhythm and stimulates the kidneys to dispose of body wastes. The herb is said to help the action of digestive enzymes and deter kidney stones. The plant is said to assist oxygen throughout the system. A study published in the International Journal of Dermatology reported great success in treating chronic leg ulcers with aloe vera. These long-term ulcers are often resistant to treatment, despite the many modern preparations available. This study told of a man who for 15 years had a leg ulcer that would not respond to treatment with a wide range of drugs and ointments. After only 10 weeks of aloe vera treatment, the ulcer began to shrink and new, healthy skin tissue began to appear. A similar case, a man with a 7-year-old ulcer was treated with aloe vera pulp. 6 weeks after treatment began, the pain had subsided and the ulcer began to heal. A study sponsored by the Atomic Energy Commission found that treatment of an ulcer caused by beta radiation was reduced from 4 months to 2 months with applications of the juice. They found that the lubricants in the leaves of the plant seemed to reduce scarring, and also the astringent qualities of the juice cleansed the afflicted area. The gel can be used to allay heat wherever it occurs in the body. Dermatophilosis, also known as rain scald or rain rot, is a bacterial skin infection affecting animals, particularly horses and cattle. It is caused by the bacterium Dermatophilus congolensis. The disease is characterized by crusty scabs, hair loss, and inflamed bleeding skin, often in areas exposed to moisture. Using acute naturally occurring dermatophilosis infections on the distal limbs of horses, aloe vera was compared to an untreated control and a standard chemotherapeutic treatment over a period of 5 days, along with a mixture of 2 treatments. Aloe vera demonstrated very significant remission in infected lesion size compared to untreated controls, and significantly larger regression when compared to the chemotherapeutic agent. no significant benefits were observed in combining the two treatments. It was concluded that aloe vera was a valid treatment for distal limb rain rot in horses in its own right, due to its combination of antibacterial activity and superior wound healing ability, and that a single application of a common aloe vera product was a suitable, cost-effective treatment. A study of Helicobacter pylori-infected rats showed that treatment with aloe vera significantly reduced leukocyte adhesion and tumor necrosis factor alpha levels. The results therefore suggest that aloe vera shows potential in the treatment of the inflammatory response of the gastric mucosa due to H. pylori infection. In a randomized, blinded clinical trial, 40 horses with grade greater than 2 lesions of the squamous and/or glandular mucosa were randomly assigned to one of two groups. Horses received either aloe vera inner leaf gel, 17.6 milligrams per kilogram body weight, twice a day, or omeprazole, 4 milligrams per kilogram body weight, once a day for approximately 28 days, after which a repeat gastroscopic examination was performed to determine disease resolution. It should be noted in another unrelated study regarding equine gastric ulcers that 4 milligrams of omeprazole was considered a high dose, whereas 1.6 milligrams of omeprazole was considered a low dose. The purpose of that study was to determine whether the effects of omeprazole were dose-dependent. The results suggested that a dose response exists for the treatment of both squamous and glandular ulcers. Improvement occurred with the high dose, but not with the low dose. Efficacy analyses were based on 39 horses that completed the trial. Equine squamous gastric disease, or ESGD, was observed in 38 horses. Improvement and healing rates in these horses were 56% and 17% respectively in the aloe vera group, and 85% and 75% respectively in the omeprazole group. In my opinion, I believe 28 days is a very short study time to allow an herb to work on ulcers. Ulcers are complex and can be multifactored. I will have an entire podcast dedicated to a discussion on ulcers in the future. It is clear that even in 28 days, aloe vera was effective in improving and healing ulcers. I can't help but wonder what the outcome would be if they had allowed the study to continue for another 30 or 60 days. The researchers treated aloe vera like a drug when it is an herb. It is undisputed that herbs do not work in the same manner as pharmaceuticals, nor are they designed to do so. If I had a horse with ulcers, I would absolutely choose aloe vera over omeprazole and give it more than 28 days to work. Aloe vera must be used with caution if administered in your animal because it possesses strong purgative qualities that may result in digestive distress and severe diarrhea. The constituents you want to avoid when using aloe for internal applications are the strong laxative effects of the anthraquinone compounds contained in the latex of the inner skin. The juice of the inner leaf material is much gentler and can be used safely in small doses, but a big drawback is its bitter taste, which can make administration a real problem. In any case, if you intend to use aloe as a laxative, it should be administered for a short time period. Like many anthraquinone laxatives, extended use of aloe can be habit-forming, leading to digestive system dependency. Overall, aloe vera is safe, has a long track record of healing, and is a gentle herb that is very beneficial to the skin, stomach, and intestines.